Hi, everyone. According to the International Diabetes Federation, 382 million people worldwide are affected by diabetes, which is expected to reach 592 million by 2035. With these growing numbers, the focus is often on lifestyle factors along with medication. A diabetes diagnosis can be a life altering event. Just like taking care of your body, taking care of your mind is equally important to living a healthy life. To help us understand the role that psychology has to play when holistically managing diabetes, we are speaking to Neha Verma, clinical psychologist and head of Department of Psychology and Wellbeing at Fitterfly. Thank you so much, Neha, for speaking to us.
Thank you, Lakshmi. Thank you for inviting me.
Well, um, why is psychological support and mental health support so important for people with diabetes, and what kind of mental health challenges do they face?
So, as we all know, diabetes is a lifestyle disorder. And the science behind diabetes is that, and I'm sure all of us know this, that pancreas may or may not be producing insulin to control the glucose levels in the body. And this science is known to everyone. But there is something more to it, which is called a mind and body connection. What you think shows up in your body, and there is for example, if you're tensed or you're worried about something for more than a week, then you might notice a subsequent headache. Your back may start hurting, or some people may even complain of cervical pain or migraine. Similarly, if you're relaxed and happy or excited about something, you will be more energetic than before. And this is exactly what mind and connection is. So, if you have diabetes and your mind is mostly occupied with thoughts like, now I have to check my sugars, I cannot eat sweets anymore, why did this happen to me, I wish I could get rid of it. These are the negative thoughts which further add stress and emotional burden to diabetes, which has its consequent manifestations in your body, just like a spike in your sugar levels. So this is why, focusing on the mind, what is going on inside the mind and how to declutter it, it is very important and can really help manage diabetes better. And when it comes to the various mental health challenges that people face, so one is the uncontrolled and unmanageable stress due to diabetes. So various things that you need to do as part of your daily lifestyle for managing it, like checking your sugars. In fact, pre and post everything that you eat, you're kind of checking your sugars. So that can be very burdensome for someone, having a glucometer handy all the time. And then maintaining a complete log of those readings so that you don't miss out and you're able to track whether it was low or high and what are the changes happening. Then taking your medications on time and dealing with the sarcasm in the social gatherings. That's sometimes very disturbing. Saying no to things that you cannot be eating in parties, and working out regularly, ensuring you hit the gym or you go for a walk daily. All of this can be very, very stressful. So that is one major challenge that I see people facing with diabetes. Apart from this, major life events which might have added any kind of trauma, or losing a loved one, or that this, and you're grieving for that person, or you have a guilt in your mind, all of this can lead to a spike in your sugars. Daily life hassles like job stress, insecurity, work pressure, trying to balance out personal and professional life, financial worries. These are all clubbed together can act as a great challenge for people when it comes to managing sugars. And lastly, I think relationships also play a very important role. So a conflict with your spouse, or disturbed family dynamics, parents not understanding you, or you are not able to express yourself properly to your family and friends, all of that can add to various stressors in your life, and they all contribute to the mental health challenges of people. So unless one speaks to a psychologist about these issues, they remain untouched. Sometimes people don't even know in their conscious mind that something like this is disturbing them. So maybe people are only thinking of managing diabetes in terms of taking medicines and controlling their sugars. But what they don't know is that managing their mental health is extremely important, because this has a major role to play in your disturbed sugar levels.
Right. Also, do you feel, considering that it's so important and it's such a major factor when we're looking, at a patient's, course with diabetes, do you feel like we're also dealing with the social stigma around discussing your feelings with the professional?
Oh, yes, of course. And I think all my fellow psychologists will agree with me on this, that mental health in our country is still considered to be a stigmatized condition. People don't talk about it openly. And I'm sure there have been several attempts to create more awareness around mental health, why it is important, why you should be focusing on it, and how it can impact your overall health and well-being. But I think we still have a long way to go. And talking about my patients, people who have diabetes, they also do not know most of the times whether stress or any emotional disturbance is affecting their sugar levels. And like I explained earlier, the mind and body connection. So if we want a healthy body, we first need to have a healthy and stress-free mind. And people often ask me that, is it really possible to have a stress-free life? And I say no. It's really not possible to have complete control over all the situations and keep your mind completely stress free all the time. But we can always learn new and effective ways to deal with situations better, so that we can keep our stress levels in control. So I would only like to say that going to a psychologist doesn't necessarily mean that you have a mental condition to deal with. You may just be worried about something which might be eating up all your time, and you're unable to find a solution for it because your mind is unable to think rationally in that moment. And that's why maybe talking to a psychologist can really help. So just go for it once and decide for yourself if it's worth it.
Right. Very well said. But after that, we look at from a doctor's point of view. If we have diabetologists or general physicians, endocrinologists who are seeing patients day in and day out. They're looking at their progress from month to month, and what are the signs that they can look out for that show that maybe the patient is not doing so well? That maybe a psychologist reference is advisable. What are these warning signs that they can look out for?
Yes, of course, there can be various warning signs, and the doctors can be really conscious about these while dealing with these patients in their OPT setups. So one is emotions. To be aware, of your own feelings and emotions. So, people a lot of times they come and they complain, so much is happening in my life. I'm feeling sad, I'm not feeling good, or I'm feeling irritated. And at any point of time when people feel that it's getting too much or they're not able to deal with it properly, that's when a psychologist might be required. So maybe doctors can look for these signals or these kind of conversations or hints coming from their patients when they are talking too much about their emotions and not being able to handle them. I think that can be a good cue for them, or a warning sign for them to maybe refer to a psychologist or suggest speaking to a psychologist. Secondly is appetite. So when your mental health starts affecting your areas, different areas of your functioning, like you're unable to properly eat, or you notice a sudden, change in your appetite, you may be eating too much or too less than your normal appetite. That's when probably it's time to take a look at the stress levels of the patient. Thirdly, sleep. So if people are not sleeping well, or if they are complaining that it's been a long time, they find it really hard to go to bed, or while lying on bed, it takes a long time for them to get sleep, or if their sleep is getting disturbed during the middle of the night multiple times. And a lot of people with diabetes, they complain of waking up at night frequently for urination. And that is when your sugars are very high. So this might be disturbing your sleep, and sleep in turn may further lead to a spike in your sugars. So complaints about sleep also are a good warning sign for doctors to understand and refer people for improvement in their sleep quality. And lastly, social relationships. So because of the emotional baggage that people carry with them, their relationships start getting affected. So if they are complaining about, a turmoil that happened in the family with the spouse, or maybe in-laws not understanding, or a tussle with the children, that is where a professional is required to sort out things for them. So I think these are the four warning signs that physicians can be more conscious about while the brief time that they get to interact with their patients. And if they can look up for these signs, then it can be really beneficial for people, and they can approach a psychologist at the right time.
Well, those are some great pointers. How do you feel that the field of psychology as such, and this new era of behavior medicine, how has that come about, and how have things changed?
Well, behavior medicine is a branch of psychology actually, which is concerned with the integration of knowledge in the biological, behavioral, psychological, and social sciences, which are relevant to health and illness. So this term and this field actually came up quite late in the 19th century, and this was a subordinate of psychosomatic medicine. But in 1975 was the first research laboratory that was set up at Stanford to analyze behavior medicine. So since then and now, I think there has been a huge transformation in this field, because various behavioral issues which might be contributing to the medical condition that you're dealing with. And when we talk about mental conditions, it can be diabetes, hypertension, PCOS, cardiovascular problems, heart related problems, hormonal imbalances, and even infertility. So behavioral issues have a major role to play in management of these diseases, and that's where behavior medicine came into existence. Now, talking about India, we do have behavior medicine centers at some good hospitals, and professionals are trying to create awareness around management of behavioral and emotional issues among people so that they can manage these conditions better. And I would say that this industry has evolved a lot in the last few years and has opened a huge area for the psychologists to explore and work. Clinical psychology principles and therapies so far, they've been just limited to psychiatric conditions only, and people have been thinking that, okay, if a psychiatrist refers me to a psychologist, I might go. But psychologists now have the opportunity to get direct referrals from general physicians, diabetologists, endocrinologists, gynecologists, heart specialists, pediatricians. So all of these people are understanding the importance of psychology and how it can play an important role in management of these diseases. So there is so much that can be done to give a healthy life to these people, and I'm sure psychologists can see a very bright future here.
Right. Well, considering the growth there in that sector, that we can, see the use of psychology as such an important treatment tool, how can we scale it up for the kind of population that we have, for the amount of patients that doctors see on a daily basis? Is there any way to scale up these services?
Well, for scaling up, and scaling up basically means that your healthcare services are reaching multiple people at the same time and through a digital medium. So I would say healthcare industry is now spreading its wings very fast using the digital therapies or digital therapeutics, as we say, as the major mode of intervention where reaching to masses is possible. And thanks to technology, digital therapeutics have actually changed the way we look at healthcare altogether. And as a professional, I would say that there are several benefits. So one is that you stay connected with the best of the domain experts through an app. So this app actually connects you to doctors, to psychologists, to physiotherapists, or to any other healthcare professional that you want to be connected with to manage your disease. Then secondly, you get to read and enhance your knowledge about so many health related facts which people are unheard about. So a lot of times doctors do not have that much of time to spend with the patients, in an OPD setup where there are 70-80 patients waiting outside every day, to educate them about what the problem is all about, how you can get better, what are the small things that you can do in your life to make your disease get better. So this knowledge which you get through digital therapeutics can be very, very valuable. Also, video calling with experts is as good as sitting in a clinic, and there is no travel required. So right sitting at your home, you get to speak to these experts through the app. And most importantly, you get to track your health data on the app. So digital therapeutics is all about evidence-based techniques that you use to get outcomes. It's an outcome-driven approach. So you know exactly how much of effort you've put in, and it will lead you to achieve what. So there is so much of transparency in terms of what to expect in a limited period of time when it comes to digital therapies. And digital medium makes it user-friendly for people to adopt and change. So I think it's very convenient. You're sitting at home, you're improving your health, no matter how complicated things may be. And as far as psychology services are concerned, I think Fitterfly is the company that's using digital therapies right now. It's the first healthcare company to develop highly specialized and customized digital psychotherapeutic interventions for management of health conditions like diabetes, obesity, infertility, etc. So, right from CBT, cognitive behavior therapy, to rational emotive behavior therapy, to gestalt therapies, mindfulness based interventions, we are using all of that remotely, and we've seen massive improvement in terms of their effectiveness. So I would say that now creativity is involved in designing these intervention techniques, and the techniques are no more limited to just a book. It's much more than that. It's more creative, it's more innovative, and it's more user friendly using the digital media.
Wow, that sounds like an exciting field to work in at the moment with all the growth that's happening around you. In your experience, and I know that you must have treated many, many people with diabetes, is there one incident or one patient that has stood out to you the most? You know, the one that's made you go, yes, this is what I'm here for. This is why I do what I do. Did you find your purpose with any one patient?
Oh, yes. So there are many that I can actually talk about, but since here the time is less, I'll talk about one case. And so, as a psychologist, my biggest win is when a patient is able to achieve his health goals and get better, both physically and mentally. And that's the win which this 41-year-old female also gave me. So she's a female, 41 years old, living in Navi Mumbai, working as a clinical researcher, and she was diagnosed with diabetes in January 2001 after having COVID, and her HbA1c was 6.9, which is a full-blown diabetes. So she had a tendency to think a lot, and mostly negative thoughts used to trouble her. She was quite tense and worried about managing diabetes, and she was actually worried because it might affect her other areas like her relationships or her work. So that was really bothering her a lot. Also, there was a lot of job stress and work pressure, due to which she used to feel irritated most of the time, and her sleep was also badly affected. So when she came on the diabetes management program, we identified that she had very high diabetes distress along with high emotional burden of diabetes. So during the therapy sessions, all the techniques were customized based on her requirements, and we used cognitive behavior therapy, expressive therapies, and mandala art therapy, relaxation techniques, gestalt journey reflection, and a solution focused approach. Now, these are all techniques which follow an eclectic approach, as in it all depends on what the kind of person I'm talking to, what she would be more comfortable doing as a person and attending psychotherapy sessions, and then these techniques are designed and shared with her. So this was an intervention which went on for around 90 days, and post the intervention, we did some analysis with her, and we found that her emotional burden of diabetes had reduced by almost 62%. So there was more than half drop in her stress levels. She was able to express and attend to her feelings better. She could cope with all the stressors more effectively in her life. And most importantly, her HbA1c came down from 6.9 to 6.3 in just 3 months. She's still continuing with us on the program by dedicating 3 more months, because she says she wants to bring the HbA1c further down to 5.5. And she eventually plans to reverse it. And apart from diabetes, she is now able to handle work pressure also in a much better way. Her insecurities related to job have subsided, and she feels more empowered now as she's getting good quality sleep. So what can be better than this, when someone feels so much better with just 3 months of intervention?
Right, and that also highlights how important the patient's entire life is, as opposed to just their physical health, just diabetes. It's more about their life in entirety that we're looking to improve. So thank you so much. Thank you so much for your time, Neha. We really enjoyed this conversation. We hope to have you back. Thank you so much.
Thank you so much.